This is Bob Finn from Global Medical News Network. I'm here at the Skin Disease Education Foundation seminar on cosmetic dermatology with Dr. Sherry Dietrich, who talked about combining cosmeceuticals with cosmetic procedures.
But the combination of cosmeceuticals with the procedures, I think, really enhance and augment the power of the procedure. And basically the way I like to use it is I use combinations of retinols, combinations of antioxidants such as green tea, along with hydroquinones.
So what combinations have you found the most effective?
I think those combinations of retinols, the combination with antioxidants, as well as the hydroquinones, I found that those three together are really a powerhouse. And occasionally I will add in my alpha hydroxy acids to actually help increase permeation through the skin. I think it's really important to decide what procedure you're going to do and then decide what combinations you're going to use based on the procedure. For example, some people are using IPL, intense pulse light, to treat melasma. And I found that if you use the hydroquinones for several months prior to the treatment with the IPL, then you might lighten it too sufficiently, the pigmentation, in which case the IPL doesn't have any target to grab onto and really affect its change. So what I do in that particular case, IPLs or even lasers, I use the hydroquinones for a period of 1 to 2 weeks prior to the treatment and then go forth that way. What I do with my chemical peels is I have the patients prep first in the morning with an alpha hydroxy acid cleanser, an alpha hydroxy acid starting at 10% and moving up, and then I also have them use hydroquinone based 4%, and I can also titrate that in office to a 6 or 8% depending on what they need. And then I go with an antioxidant such as green tea and a sunscreen. And I find that combination in the morning works very well. And then in the evening what I do, again, have them use the alpha hydroxy acid cleanser, and I combine that with a retinol. And again, I can titrate that based on their skin type and their skin condition. And then I mix that with the antioxidant such as green tea. And I do that for a period of about 2 weeks prior to the chemical peel. The chemical peel that I'm presently using is a combination of a 1% retinol with 14% hydroquinone. And we leave it on as a leave-on mask that they put on for about 5 to 8 hours and then wash it off at home. And then for the following 2 weeks, they use a regimen of a retinol and hydroquinone along with their sunscreens and a calming lotion, and they do that for a period of 2 weeks, and then I follow them up.
The term cosmeceutical sounds so benign. Is there anything you need to worry about with using these?
And so you have to be careful in very sensitive skin patients with the retinols to use lesser concentrations rather than greater concentrations. I found that they come in anywhere from a 2x all the way up to a 10x kind of concentration, and I think that starting with the 2x is better for sensitive skin patients. And that's why you do it as a prep prior to actually doing procedures, to make sure that that's agreeable with them prior to doing a more invasive procedure.